Yogita Chaurasia, counseling for a guarded visual prognosis.
Good morning, everyone. Thank you for the opportunity. Yeah, thank you. So, we have counseled a patient for a guarded prognosis now and then. So, I'll just make sure that we know the salient points. A guarded visual prognosis means that true extent of disease potential, visual potential after an intervention or during the course of disease is uncertain. Can be due to primary pathology, due to existing pathology, or due to can be some cases there can be a nil visual prognosis also. There are multiple causes of visual prognosis guarded due to a primary pathology. Similarly, there are many cases where there are some co-pathologies which can complicate the primary case. And there are some scenarios where there is no visual prognosis, nil visual prognosis, or no uh, visual gain after a process, or even without a process. So, what are the so there's a clinical evidence of there's a study conducted to see the causes of guarded visual prognosis during a cataract surgery, ARMD, glaucoma, corneal or vitreous opacity, diabetic retinopathy. These are the main factors noted there. So, what is the need of counseling? So, it can help patient understand the condition and accept their prognosis, and it can also help patient make decisions about treatment such as surgery and improve compliance with their treatment. Counseling can help them motivate for alternate options also for rehabilitation when needed. When to provide counseling: before a surgical procedure, before any other procedure, or even if we are not doing any intervention, like in the cases of RP and all. So whenever there is a guarded prognosis, we have to really explain it. When to provide counseling for GVP can be pre-operative, pre-procedure, post-procedure also we can tell them about the outcome, and long-term support is also needed. Who can provide counseling? The treating doctor, junior assistant doctor. Professional counselor can be hired, or you can make a separate counseling department in your hospital, and any staff can be trained for the counseling also. The types of counseling: there can be individual counseling, this is to talk one to one with the patient to explain about the disease and treatment plan. And there can be group counseling, which can be client centered, where a patient and his family are explained in a group. And there can be a group having a common ailment which can be addressed at a community level. There are two core components of effective counseling. First is providing the information, and second is taking an informed consent. Providing the information, that is the most crucial part, because the patient understands everything in this. So you have to mention the diagnosis, the intervention they need, the need for intervention, the risks for undergoing or delaying the intervention, and the possible benefit, and the long term prognosis too. So it should provide you the patient with a very clear diagnosis, explain the condition in understandable terms, and avoid complex medical jargon. Detail all the available intervention, including surgery, medical management, and observation too. The honest discussion of risk assessment should be done, and you should set realistic prognosis in front of the patient. The second and the most important component is taking an informed consent. But without priorly giving information, we can't rely on this alone. So it extends beyond signature collection. It represents a collaborative dialogue, ensuring patients truly understand their situation and treatment choices. So this is taken from an AIOS guided. There's a mini book of consent provided by AIOS. So that is taken from that. What are the key components of an informed consent? First of all, language should be, if the patient is a Hindi speaking or a Marathi speaking patient, then you have to do it in their language. Patient details has to be proper. Diagnosis has to be mentioned. I has to be mentioned. Procedure required and its need or indications, risk and benefits, reasons for the guarded visual prognosis, and declaration by the patient, declaration by the doctor. So these are the declaration by the patient and the doctor. The patient basically says, okay, I understand everything, and the doctor says, I have explained everything. So, ATCOM is very important in counseling. Attitude is, the patient's attitude towards counseling can be affected by a number of factors, including their understanding of the condition, their faith in treating doctor and the treatment plan, and the availability of a proper time and setting, which is equally important. Ethics. The counselor should use empathy, respect, and support, and pay attention to the recipient's emotions. Communication is very important. The counselor should use simple, understandable language, as I said. They should also allow the recipient to ask questions and express their emotions too. So choose a comfortable and private location. Provide the counseling in person when it's convenient for the recipient and without any interruption. That is also important. Allow the recipient to be accompanied by a support person or a family. Prepare for questions, give explanation, allows other to speak, and explore solution with those involved. So there are certain barriers. First is the language barrier, you should overcome it, and then second is educational differences. The patient, you should look at the how educated or how and explain the complexity at their level. And culture sensitive, there are certain cultural beliefs also about the illness and treatment. You should respectfully give your opinion about that. So active listening, emotional validation, and an honest communication builds the patient trust. Setting realistic expectations prevent disappointment and builds trust. So discuss best case, worst case scenarios, most likely scenarios, while emphasizing that individual outcomes may vary significantly based on the multiple factors. Immediately follow up, schedule timely appointments to address emerging consent, and so it should not be a one time thing every time. Sometimes we can just provide the counseling, tell them to come back and again ask question and then take the consent. That also can be done. And resource provision. If they say what to do, then you have to have a resource of providing them further, guiding them further how to proceed if you are not providing that facility on your at your clinic. And ongoing additional support should also be. So it is said in the studies that it improves compliance by 78%, reduce anxiety of the patient by 65%, and increases the patient's satisfaction by 82%. So, effective counseling for guided visual prognosis is essential for patient care and should be emphasized in routine clinical practice. It builds better doctor patient relationships, improve treatment compliance, and help patients adapt to visual challenges with greater resilience. Thank you.
Regarding this counseling and consent, this is looking very simple, but one has to be
Yeah.
very careful.
Yeah.
And now the alternative of video counseling is also
Yeah.
there sometimes.
Yeah.
And one thing I'd like to mention, because last week in our local IMA, we called one legal advisor to discussion upon this counseling and this consent. So one point I got from that meeting, maybe you may be aware of that, from 12 to 18 years, consent of child as well as parent both required.
Okay.
Because previously we are under the impression that if adult, then patient can give the consent, and if छोटा बच्चा है तो उसको फिर उसका गाइड पेरेंट ही देगा, लेकिन 12 to 18 signatures of both child as well as parent both required. Yeah.
Yeah.
Yes. And if
For
you
video,
want to use,
for even for doing case reports and all, we are not required to
yes,
take
exactly.
and produce that counseling, that consent paper also with the case reports.
Yes,
Yeah.
exactly.
And in such a situation, you need to also explain to the patient that your identity will not be
Yeah.
revealed. Okay. Same line wise, because we have done the translation in various languages and put
But
it.
main point
But
is
this is good. Like,
make him understand what
Yeah.
you are saying, not just signature.